The broadcast is now starting. All attendees are in listen-only mode.
Well, good evening, everyone, and welcome to tonight's edition of the RX Question Lab. I'm Jeff Downing, and I am thrilled to be your host for this evening's session where we're going to slice and dice a set of questions that will help you prepare for Psych. Yeah, we're going to be delving into the intricate world of psychiatry. We're going to dissect a set of board-style questions and shed light on key concepts that are fundamental to your preparation, not only for USMLE exams, but CBSSAs and all of your regular exams. So should be a good one. Joining me this evening is a special co-host, Dr. Richard Blumengold. With his experience and insights, we're incredibly fortunate to have him with us tonight. So Richard, would you like to introduce yourself to the crowd?
Thanks so much, Jeff. Good evening, everyone. My name, like Jeff said, is Dr. Richard Blumengold. I am a senior internal medicine resident here in Miami, Florida, and I am also an RX coach. And I've been working with students just like you guys for upwards of 6 years now, working through and prepping for different board exams. So I'm excited to be here and to help show you guys how to make and simplify these questions to guide you on your success in your USMLE journey.
Excellent. Thank you, Richard. We also have Kate in the background helping to answer questions from all of you. So again, you can go to that question box and enter any queries or comments that come up this evening. Together we're going to work to guide you through the complexity of some of these psychiatry questions. We're going to work to give you some of the tools and strategies that you need to confidently approach this, this important aspect of your exams. Our goal here is make sure that these sessions are interactive, engaging, and rewarding. So at the end of tonight's session, we'll be having a special raffle where one lucky participant will win a complimentary subscription to RX 360 Plus. So that is going to give you, our full suite. That's our QMax question bank, RX bricks, all of our express videos and flash facts. So again, one of you will be able to walk off with that, enhancing your preparation and hopefully boosting your readiness for the exams. But you do need to be present to win. So with that, we're going to dive into the fascinating realm of psychiatry and hope we can make the most of this opportunity to learn from each other. One thing I want to know, though, is a little bit about you. So what we're going to do is we're going to launch our first poll of the evening. And it's going to be the easiest question. Who are you? So we use the quick poll feature from GoToWebinar for answering questions. So this gives us a chance to see who is in the crowd tonight. Once roughly 2/3 of you have voted, we'll close the poll. But you can go ahead and let us know if you're M1, M2, M3, M4, or if you're an IMG or FMG. Glad that you're all here. So let's see, about 2/3 of you voted. So I'm going to go ahead, get ready to close this poll, and we'll share the results. So got a very strong IMG contingent tonight. Almost 2/3 of you got number of rising M2s and some M3s here, as well as some M4s. So welcome all of you, even some M1s. You can never start too early, right? So thanks again for being here. Let's jump into the questions. I just want to note here at the beginning, especially for those of you who are new to Question Lab, this session, will be pulling from some of the methods that we've developed for our students at RX Coach. So, what we want to do is make sure that students are ready, and part of it is there's a lot of things that you need to understand, a lot of things that you need to be able to memorize, but there are also a lot of techniques that you can master that will help you on test day. So we're going to walk you through our steps for answering a question as we go through this. And, we hope that there are some things that you can draw from that will help you so that on test day, you've got a sound and evidence-based approach to answering questions so that you can really focus on doing your very best. So with that, we're going to open up question number 1. And what you're going to see here is that there's something missing, right? And that something missing is the answer choices. And that's by design. So the first step for us is that we ask you to cover up those answer choices. The main reason here is that we want you to focus, and if you see an answer choice that contains, maybe it's a drug you've never heard of, or maybe it's a concept that you're shaky on, there are little things that can throw you off your game. So what we want you to do is we want you to take each question the same way, right? So for us, we say cover up those answer choices, and then we want you to read the lead-in. And the lead-in is the actual question part. So in this case, which of the following additional findings is associated with this patient's most likely diagnosis? Not patents. Sorry for the typo there. So we say read the lead-in, and then once you've done that, now you have an understanding of what kind of information you might be looking for, what data will be important for you as you read the vignette. So we've read the lead-in, now we're going to read the vignette. A 17-year-old girl is brought to the physician by her mother, who is concerned that her daughter is not eating well and is focused on losing weight despite being thin. The patient believes she is overweight and exercises twice daily. She is 165 centimeters, 5'5", and weighs 44.5 kilograms, roughly 98 pounds. Body mass index is 16.3. She is wearing multiple layers of clothing and yet still complains that the office is cold. Physical examination reveals her body is covered in soft, fine hair. Okay, so now we want to read that lead-in once again. Which of the following additional findings is associated with this patient's most likely diagnosis? I'd love for you to go down to the question box. Let us know how many steps you think that this will take to solve. And what I'm going to do is I'm going to hand it off to Richard to work you through this one. Richard?
Thanks, Jeff. So as Jeff said, why don't you guys take it on over to the question box, and you guys let us know, do you think this is a level 1, level 2, or a level 3 question? We'd love to hear what you guys think. And while you guys are doing that, these questions, especially psych questions, rely heavily on you guys looking at the patient and looking at kind of the language that's used to describe what's going on. So we have some answers pulling in here, seeing some level 1s, level 2s. Okay. I'll give you guys another few minutes to give you a few seconds to give you guys his opinion, and we will reveal the answer choices. Okay. Alrighty, so why don't we go ahead and show the answer choices so we can take from what Jeff was explaining to you guys of how we approach, even with the answer choices at RX Coach, we want you guys to start from the final answer choice. So answer choice E and work your way up. And the reason behind this is going to be, we want you guys to see all of the answer choices. We don't want you coming up to one of the answer choices that maybe it's something familiar or something you crossed paths with during your studying, and it looks familiar and looks good, and you don't even look at the remainder of the answer choices. So which of the following additional findings is associated with this patient's most likely diagnosis? Answer choice E, stress fractures. D, menorrhagia. C, intestinal obstruction. B, enlarged thyroid gland. Or A, diarrhea. And what we're going to do is we're going to open up a poll, And you guys are going to drop what you think the answer is into the poll. And like Jeff said, we'll wait until about 2/3 of you guys have given your votes, and we will reveal the answer.
Okay, very good. So we've got the poll is launched. So go ahead and take your best shot. Think about what you learned about this particular patient, and what additional findings are associated with this patient's most likely diagnosis. If you were looking at their chart, what else do you think you would see? Okay, so about 3/4 of you have voted. So I'm going to go ahead and close the poll, and let's take a look at the results. So almost half of you thought that stress fractures would be one of the additional findings you'd expect with this patient's most likely diagnosis. It's also kind of a split for second place between menorrhagia and an enlarged thyroid gland. So interesting split there. So let's go ahead and hide the results, and let's reveal the answer. And the answer is answer choice E, stress fractures. So well done, everyone. That's a win for the crowd. Nice job. If you didn't get it right, that's okay. Richard's going to walk us through this one. Richard?
Thanks, Jeff. So this patient that they're describing, this 17-year-old female, is presenting with some pretty characteristic signs of anorexia nervosa. The question opens up by saying she's concerned, the mother is concerned that her daughter isn't eating well, and she's only focused on losing weight despite being quite thin. She's displaying classical symptoms of both believing that she is overweight, as well as having compensatory behavior. She's exercising twice daily. Big tip-offs in the question stem are when they focus upon the BMI. Now, for your purposes, for the test, any BMI that is less than 18.5 should get your mind thinking that the patient is either malnourished or does have some eating disorder. She's wearing multiple layers of clothing, and this yet complains the office is still cold. And this can lend itself to the classic anemia symptoms that they're seeing. Patients with anorexia will have things like excessive dieting, fear of gaining weight, body distortion, and in young reproductive age females, it will also present with amenorrhea, so a lack of menstruation. So that's also something that you should keep in mind. The correct answer here, stress fractures, the reason for this is estrogen itself is bone protective. So when patients with anorexia nervosa, when the body doesn't have a sufficient calorie intake, what ends up happening is estrogen, okay, stops being produced in as normal quantities because our GnRH, LH, FSH, estrogen axis becomes suppressed due to the actual hypothalamus being dysfunctional, as well as elevated cortisol levels, which can limit the production, okay? Other things that you can see with the stress fractures, or if you start seeing bone fractures with very minimal exertion, for example, a young, healthy 17-year-old female that falls on an outstretched hand with not a lot of momentum, it shouldn't snap bone. That does require a significant amount of force. If you're seeing what's referred to as pathologic fractures in a young patient, the idea could be that maybe there's some nutritional deficiency. So stress fractures will be correct here. Okay. And with that, I also just one more thing terminology-wise on the physical exam, her body is covered in soft, fine hair. You may or may not see this described in the question stem as lanugo, L-A-N-U-G-O. It's just a term that describes this very fine, soft hair that is characteristic of anorexia patients. And with that, I think we can move on to our next question, Jeff.
That's great, Richard. One question from the crowd: when we talk about a one-step, two-step, three-step question, what does that mean? How do you describe that?
Well, that's a great question. A one-step question is something that when you're reading the STEM, you can ascertain the answer directly from what's given. You don't have to infer beyond just what the presentation is. A level 2 question can be you're getting the diagnosis, but they're asking you maybe something about the treatment, okay? Or a level 3 question, when we move beyond that, you can understand what's going on with the patient, you know what they're going to do treatment wise, and they're asking you to infer what may be a side effect of the treatment or something that would require a third level of thought process with the questions. That's when we use the term level 1, 2, and 3. It's describing how deep into the knowledge you have to go to get an answer.
Very good. Okay, so we're off to a good start, everyone. That was well done here on hammering that one. Let's move to question number 2. Once again, we've got the answer choices covered up, and we're going to start with the lead-in. Which of the following findings would help confirm the most likely diagnosis? Which of the following findings would help confirm the most likely diagnosis? So again, now you have a sense that we're going to be, you're going to hopefully be able to figure out what the diagnosis is for this patient, and what kind of findings might help confirm it. So again, there's a lot that you can really draw in from the lead-in that will help you hopefully pick up the key details from the vignette. So let's read that now. A 58-year-old woman comes to the emergency department complaining of lightheadedness and urinary retention over the past day. She has a history of depression and of urinary incontinence, for which she takes medication. She recently was started on a new antidepressant due to lack of response to previous therapy. Her pulse is 110. She appears flushed, and her skin is warm and dry. Which of the following findings would help confirm the most likely diagnosis? Take a look at that. Head down to the question box. Let us know how many steps you think it will take to solve this one as I turn it over to Richard.
Thanks, Jeff. Now, looking at this question again, we're given a little bit of history. We're given some things that this woman may be taking. Okay, we can kind of infer from her history. She takes medication. So this is relying upon you to know kind of what medication we would prescribe in this instance. Okay. So we got some answers here rolling in. Level 2, level 3. Okay. So now we'll do again, just like we did with the last question. We're going to start from the bottom. Again, we'll read the lead-in. Which of the following findings would help confirm the most likely diagnosis? E, tremor. D, muscle rigidity. C, jaundice. B, blurry vision. And A, allogia. And we'll open up that poll again so you guys can give what you think is the correct answer here.
Very good. So yes, we've got the poll open. Think about those findings. Think about that patient. Which of these following findings would help confirm that diagnosis? We often remind our crowd here every time we do question lab that you should never leave a question unanswered on test day. You're not going to be penalized for it, and you never want to leave a question unanswered here during question lab, because you're obviously not going to get penalized for it. We're all here to learn. So about 2/3 of you have voted. I'm going to give you a few more seconds for those of you who are still trying to make a decision here. Looks like we've got another clear leader, and actually looks like the voting is comparable to question number 1. So let's go ahead and close the poll. Share those results. So again, about 43% of you went with blurry vision. You think that would help confirm the most likely diagnosis. And there's again a race for second place between muscle rigidity and tremor. Okay, well, this is good. So let's go ahead and hide the results. And we'll reveal the question. And the answer is answer choice B, blurry vision. So once again, the crowd prevails. Nice work with this one. For those of you who didn't get that one, that's okay. Again, we're here to learn, and Richard's going to help break this one down for you. Take it away, Richard.
Thanks so much, Jeff. So great job on this one, guys. This was not a very obvious question. So 58-year-old woman comes in with lightheadedness and urinary retention. She was started on an antidepressant due to her lack of response to previous therapy. And this is where I really want to draw your attention in this question. When we talk about depression, for the most part, SSRIs or SNRIs, depending on the situation, are going to be our first lines. But this patient, unfortunately, didn't have a proper response to to what we would presume would be the SSRI. So it makes you have to think of what would be some second-line medications. In addition to this, they note specifically, they don't give you a full set of vitals. They note specifically her pulse is 110, as well as telling you that she is flushed and her skin appears warm and dry. Now, combining all of this should bring to mind when you guys learned about anticholinergic toxicity. Okay, so presence of things like tachycardia, flushed warm skin, urinary retention in the setting of a new antidepressant drug should bring to mind tricyclic antidepressants. Now, tricyclic antidepressants are not first line anymore, but they can be used in the setting of treatment-resistant depression or SSRI failing depression. They're more commonly our second and third line agents. So with this, she went from having a history of, if we look here, she had a history of urinary incontinence, and now she has retention. So it's managed to reverse it. M3 receptors on the bladder are what mitigates and allows you to urinate because it's a parasympathetic response. So muscarinic 3 for the bladder, anticholinergic effect of TCAs would block this and would cause an abrupt urinary retention. In addition, the reason the blurry vision is the correct answer here, as well as we would also see in the eye mydriasis, okay, or the dilation of the, or the constriction of the pupil. This would be, dilation of the pupil because of blocking of the muscarinics. This is, again, all mitigated by the anti-muscarinic effect or anticholinergic effect that is present with tricyclic antidepressants. This question kind of relied on you guys not only knowing your first line medications, but knowing the second and third lines, as well as the side effects that can come from them. With these questions, one thing I always preach to my students, and we as a group always preach to students, make sure we are paying attention to time frame when it comes to initiation of medications. So she has a history of urinary incontinence, and now she's taking this medication. So she was recently started on an antidepressant due to lack of response to previous therapy. So this is a new onset of symptoms that we can connect to initiation of a new drug. This will allow you guys to own in on and narrow down your answer choices going forward. And with that, I will turn it back over to Jeff for our next one.
Very good. Well, thank you, Richard. Again, we're off to a good start. First half of the evening is a successful one. Before we dig into question number 3, just want to tell you a little bit about RX Coach. So, whether we've got a good mix of students here, from M1s to M4s, we've got IMGs, and a lot of you that are here have a goal of taking and passing and succeeding on step 1. So, but you may be finding it hard to navigate the complex terrain of these questions, and that's kind of why we're here. We developed RX Coach specifically for med students like you. We understand that mastering the step 1 exam, it's a journey, but every journey needs a guide. And that's where our tutors come in. We've got great tutors like Richard, not just academically brilliant, but they're also RX certified. They've undergone rigorous training to gain a deep understanding of the content and the format, and also the best ways to help encourage you and guide you every step of the way. We start with a comprehensive 160 item evaluation designed to identify your unique strengths and weaknesses. And basically, we can take this knowledge and customize a plan which focuses on the areas where you need to focus your time. RX Coach students also get complimentary access to RX 360 Plus. That includes Step 1 QMax, Flash Facts, Express Videos, all of our bricks. Again, all the tools needed to help reinforce your learning and help you apply your knowledge confidently on test days. So if you find yourself at a point where you could use a mentor, you could use someone to help you keep to be accountable to yourself, reach out to us at RX Coach. We'll put the link here in the chat, and you can set up a free consult and learn more about the program. So, again, you're not just studying for a test; you're really preparing to save lives, and we want to help you in any way that we can be successful in your journey. Okay, well, we are again, we're getting ready here for question number 3. As a reminder, we will have a raffle at the end of the evening, as well as announcement of our special offer. So with that, let's go into question number 3. Again, we have covered up the answer choices, and we are going to start by reading the lead-in. Which of the following symptoms reported by this patient is the best indicator of a complicated grief reaction? Okay, so this is an interesting one when you see this kind of a lead-in, because now what type of patient you're gonna be dealing with here, and the kind of data that you should be trying to absorb as you're reading the vignette. So let's read that vignette now. A 47-year-old woman presents to the clinic because of depressed mood. During the past month, she has noted near constant sadness with frequent episodes of crying, anger, and more frequent tension headaches, particularly during times of stress. Her husband died of pancreatic cancer approximately 1.5 years ago after a rapid deterioration. She says that she returned to work 2 weeks after his death and felt emotionally numb at that time, which she now feels guilty about. She weighs about 1.3 kilograms less than she did 2 months earlier. Okay, with that, let's read the lead-in one more time. Which of the following symptoms reported by this patient is the best indicator of a complicated grief reaction? Head down to the question box. Let me know how many steps you think it'll take to solve this one as I pass it over to Richard.
Thanks so much, Jeff. And like Jeff said, this is a pretty interesting question because this lead-in does give you what you're going to be expected to get. There's no inferring. That's telling you what it wants right away. Waiting to see what you guys think about the level of question. But in the meantime, we will read the answer choices. So again, the lead-in: which of the following symptoms reported by this patient is the best indicator of a complicated grief reaction? E, weight loss. D, the amount of time since her husband died. C, headache in times of stress. B, feelings of guilt. And A, anger. So we'll go ahead and open up that poll, and you guys have been on a roll tonight, looking to keep it going.
Yes, indeed. So we've got the poll launched. Take a look at that. Think about this patient. Think about what she was telling you. Think about yourself in that position as the physician. And out of all of them, what you think might be the best indicator of a complicated grief reaction? Again, may not be the only indicator, right? But you need to be able to prioritize. Let's see, about 2/3 of you have registered your opinion here. So let's go ahead and we'll get ready to close the poll. I'll give you just a few more seconds for those of you who are still deciding. Okay, let's close the poll. And we're going to share the results. So over half of you feel like it's answer choice D, the amount of time since her husband died, 1.5 years, right? Almost 1/3 of you mentioned feelings of guilt as the best indicator. And about 12% of you went with weight loss. Okay, so with that, let's go ahead and hide the results and reveal the answer. And the answer is indeed answer choice D, the amount of time since her husband died. So nice job, everybody. Again, that's over half the crowd got that one right. That's great. If you didn't, that's okay. Or maybe you guessed, which is okay too. Richard's going to help us walk through it and explain why this is the right answer. Richard?
Thanks, Jeff. So yes, the answer choice here is going to be D, the amount of time in which it's been since her husband has died. Now, one of the things that you'll find not only with these questions, but in clinical practice is patients and family members of patients will deal with grief differently. And there's an expected course that people that suffer the loss of a loved one will take. This is not to say that everyone that loses a loved one will have what's referred to as complex bereavement syndrome, which is a prolonged pathologic grief. But there are signs that you need to be aware of clinically to tell what the difference is going to be. So this patient has, during the past month, she's had constant sadness, nearly constant sadness, episodes of crying, anger, more frequent tension headaches, particularly in times of stress. Now, her husband died of pancreatic cancer about 1.5 years ago after a rapid deterioration. For complex bereavement syndrome, we're talking, and this is complex bereavement, can be referred to as both pathologic grief, complex bereavement syndrome. They're all synonyms within the DSM-5 manual, but it is defined by prolonged grief of greater than 6 to 12 months, as well as grief that can be inhibited, delayed, denied. The fact that this patient came right back to work after the death of her husband 2 weeks, combined with the fact that her husband suffered such a rapid deterioration from health to death, and the fact that it's been present for 1.5 years after the death, it's arising 1.5 years after her husband died, this is a delayed grief reaction. All of these combined give a higher risk for the patient to have complicated grief. Normal bereavement, normal mourning of a loved one can include guilt, anger. Sometimes it can somaticize as things like headache. Her weight loss, I'm sure some of you noted that she did lose some weight, but typically we only believe weight loss of about 3.6 kilograms or more would be worrisome. It is not uncommon for patients to have a lack of appetite shortly after the death of a loved one. It's not uncommon for people to lose weight, especially elderly patients who've been married, that the lifestyle changes. You may see questions where a husband comes into the office and his wife recently died and she used to cook all the meals, and now his diet's drastically altered, so he's lost weight. The number one symptom that best indicates presence of a complicated grief reaction is what you guys chose, the amount of time since her husband died. This did not just happen a month or two ago. This happened 1.5 years ago, and she is experiencing extremely debilitating, severe symptoms of grief, okay? Anger, guilt, headache, we all talked about, that can come up in a normal grief reaction. And the weight loss, she doesn't quite meet the criteria. So D would be our correct answer here, like you guys chose. I hope that makes you guys understand complex bereavement a little better. And I will turn it back over to Jeff for our final question of the evening.
Yeah, that's good. A couple of folks appreciated this question. Good. Yeah, that's the thing about psych. It's a lot about the storytelling, and I think a lot of folks can connect with it, right? So, in any case, nice work, and thanks for the explanation there, Richard. Let's go into our final question of the night. So, again, you guys have been crushing it tonight. We're 3 for 3. And we're going to see how we do here on the final question. Again, we'll have the raffle here after this, so make sure you stick around. So once again, we've covered up all the answer choices, and now we start with the lead-in. Which of the following is the patient's most likely diagnosis? Okay, so don't even really have to to ask about the levels here. This is kind of your classic your classic step 1 question. So with that, we know what kind of information we should be looking for as we read the vignette. So let's do that now. A 24-year-old man who serves in the military comes to the clinic because of sleep disturbances, psychological distress, irritable behavior, concentration difficulty, and recurrent nightmares. The patient underwent amputation of the first and second digits of his right hand after sustaining an injury during combat 3 weeks ago. He was sent home after his surgery and has not been sleeping well due to recurrent nightmares about the skirmish that resulted in his injury. He reports persistent feelings of frustration and anger, especially when looking at pictures of himself in uniform. He admits to being easily startled and always feels very tense, despite living in a safe, small town. So again, the question, which of the following is the patient's most likely diagnosis? You can go ahead and let us know that you think this is a step 1 question as I turn it over to Richard. Richard?
Yeah, thanks, Jeff. Why don't we, like Jeff said, I don't really think we need to ask how many levels this is, so we'll just go ahead and pull up the potential answer choices here. Which of the following is the patient's most likely diagnosis? Is this E, somatic symptom disorder, D, post-traumatic stress disorder, C, conversion disorder, B, adjustment disorder, or A, acute stress disorder? And we'll open up the poll, and you guys can go ahead and drop your answers in there.
Okay, the poll has been launched. Let us know which disorder you think this patient is suffering from. I do want to note as you answer, we have another webinar tomorrow night. We're going to have one of our special Secrets of the USMLE webinars, which is going to focus on the cardiovascular system. So I've put the link in the chat. So if you haven't signed up, make sure you do that. We're going to we'll have another raffle tomorrow night where we'll focus a little bit more on some of the key concepts. But the Secrets of the USMLE webinar is always a favorite, and especially if you're either needing to get a refresher on cardio, or maybe you've got cardio coming up this year. We can help set the table for you. Okay, over 3/4 of you have voted. Let's go ahead and get ready to close this poll. So interesting. This is another 2-horse race. So almost 2/3 of you went with PTSD, but 1/3 of you went with acute stress disorder. So interesting. let's see what the answer is. We'll hide the results. And the answer is acute stress disorder. So, well, streaks are made to be broken, right? So we weren't able to close out a 4-for-4 night, but that's okay because there's obviously information that you were seeing in this question that led a lot of you towards PTSD, and that means it would be helpful for us to kind of refresh ourselves on the differences. So, Richard, you want to walk us through this one?
Absolutely, Jeff. So this question, I saw there was a few people in the questions that kind of dropped PTSD almost immediately after seeing the combat. But this brings up a point that I told you guys with regards to the psych questions. We really need to watch out for the story and for the time frame. The time when symptoms arise compared to the stressor, the length of time of symptom presence. There's a lot of things and intricacies with psych diagnosis that rely upon the presence of symptoms for a certain amount of time or the brevity of the time of them. So this 24-year-old gentleman comes in, he served in the military, he comes in, he's got psych disturbances, irritable behavior, concentration difficulty, and recurrent nightmares. He underwent an amputation of his parts of his right hand after he was injured in combat 3 weeks ago. That is our big key to this question. He just got injured and got amputated 3 weeks ago. He was sent home. He has not been sleeping well. He's had recurrent nightmares about the skirmish that resulted in his injury. He's got persistent feelings of frustration and anger. He admits to being easily startled and feels very tense despite living in a safe small town. Now, does this sound like PTSD? Absolutely. This is checking a lot of boxes for PTSD. The one thing that it doesn't check the box, PTSD and acute stress disorder exist on a spectrum of time. Acute stress disorder is diagnosed when a patient experiences a traumatic life event leading to sleep disturbances, hyperarousal, persistent negative feelings for less than 1 month. If that exact symptom presentation is present for greater than 1 month, PTSD is the diagnosis, okay? Now, acute stress disorder, as a diagnosis, there needs to be a time frame of between 3 days to 1 month. That is the time frame for acute stress, okay? After 1 month, it becomes PTSD. So other answer choices here, because we have these other things, adjustment disorder could be something that you may consider in this patient because they say he has persistent feelings of frustration, especially when looking at himself in pictures of himself in uniform. Now, I never served in the armed forces, but you constantly see patients that come back or hear stories of people coming back from war that do have a difficult time adjusting back to civilian life. But adjustment disorder doesn't just apply to military. It could be anybody. Maybe they lost both of their parents and had to move to a different state and up their lives and change, or they went through a divorce. Adjustment disorder as a diagnosis is significant emotional behavior or distress after an identifiable stressor, but it requires that the depression and anxiety be present for within 3 months, but less than 6. Again, noting how much the time frame is playing a factor in these diagnoses. Conversion disorder is diagnosed when you have a voluntary motor or sensory symptoms like weakness, balance problems, tremor, hearing impairment that you cannot explain by a neurologic or other medical conditions. This patient has a clear psychiatric disturbance from a life event that you can point to as the trigger. Okay. One thing that I will leave you with the explanation is when you're going through your preparations and you have those tables and those charts that specifically say how much time symptoms need to be present, please take the time to notate that. A lot of these questions, like which of the following is the patient's most likely diagnosis questions, are very easy point grabbers for you guys so long as you pay attention to the time frame. If they give you an amount of time, symptoms have been present in the question set, I suggest, and I suggest to all my students, please highlight it so that you can have it in the front of your mind as you're looking through the answer choices. If you miss this question, don't get discouraged. This just shows that you need to review those timeframes a little bit more detailed, and next time you guys won't get it wrong again. And with that, I'll turn it back over to Jeff.